Thank you, everybody, for being here. And as Zoom has kindly reminded, this meeting is being recorded. Um, this time has generally worked well for our members, but it's a busy time with school letting out and all of that. So it's great that we're able to record it and share it with those folks who can't make it. I know several of them had conflicts and let us know about it. So today, the grant impact update is from the Early Learning Coalition of Orange County, our longtime partner in several initiatives. I'm super excited. Um, I'll do a brief intro, hand off to Lauren to talk about some exciting new things that are coming up, and then to Leslie Hartog, who is one of the two people that leads our grants team, and then we'll hand off to Karen and the team to talk about two of the initiatives that we've worked on recently. So with that, I am Renuka Sastry. I am going to be attempting to make the PowerPoint slides go. So we'll see how that runs. So just as a reminder, our mission is to help improve the lives of women and children through our unique approach to collective giving and collaborative grant making in our community. One of the best parts of 100 Women Strong is one, that it's a giving circle, and two, is the deep relationships and the partnerships we build both between us and the community partners that we work with, but also connecting our community partners to come up with new solutions. To date, we've invested $725,000 in the community with 21 grants. A few of them have been with the Early Learning Coalition. And the general areas of impact, and these are sort of the broad areas of impact that we've identified, impact how the well-being of women and children in our community. I won't go into it a whole lot here, but if you have questions on any of these, please contact us and we can share more. But it's essentially all of the key elements from food and shelter to safety and justice to financial resilience, education, community networks, mental health, all of the things that play into building resilience amongst the most vulnerable children and women in our community. Some past grants, Harbor House, some domestic violence survivor support there. Foundation for Foster Children, which many of our members went on to be directly individually involved with. Second Harvest Food Bank, a number of early education initiatives as well. The 2021 grant focus is going to be at the intersection of domestic abuse survivors and supporting them with building their financial independence. We're in the thick of that now. Most of the people on the call are already members. If you're not already a member, June 30th is the cutoff date for when those member dues will go into this particular grant initiative. We're doing some really exciting work with that. And again, we're happy to share more about it. We've found some really good partners that were already doing some great work and put them together to come up with a solution that I'm really excited about exploring. So I'm going to now hand off to Lauren, who is co-chair with me of 100 Women Strong, to talk about upcoming events and a new thing we're trying this year. And I have a slide for that, Lauren, about mini grants for our community nonprofits. So Lauren?
Yes, thank you, Renuka. So I'm Lauren. I'm co-chair with Renuka, and I kind of manage our events and our outreach and our membership engagement. And so the big kind of exciting announcement is that we are doing in-person events again. We are back, and our members are very hungry for engagement with each other. So we have our monthly member breakfast. So that's every month at the last Friday of the month at the same place, the same time. And that's Hamilton Kitchen at the Alfond Inn in Winter Park at 8 o'clock. And so that's just a casual, no agenda, just our members connecting over breakfast and coffee, and having an opportunity to just get to know each other, because many of us don't know each other after this past year. And then this Friday, if you are a member, there is a grants meeting. So the grant that Renuka just talked about with helping survivors of domestic violence achieve economic independence. We're going to be discussing the proposal and moving that forward. So that's this Friday. So make sure to sign up for that. If you are a member, that is a member only event. The monthly breakfast is for members and guests. So if you know somebody who you think would really be a great fit for 100 Women Strong, you are welcome to invite them. And it's a great way for them to understand who we are and what we do. And then we are going to be releasing our calendar for the rest of the year soon, very soon, with actual dates for actual live events that we're going to continue to do. Good Work Socials, which are our hands-on volunteer events. We're going to be doing some neighborhood meetings where we're going to get together with other members regionally. And then we are also reigniting our industry events. Our industry events bring together women from different industries, and these are outreach events. So we're looking to engage new members. And we have a partnership with the Orlando Pride, which is the women's soccer team, where we literally have 5 Olympic women's soccer players on this team. And they are going to be giving free tickets to all members and anyone who attended our summit last year. So just tons of exciting events happening, and all of our members and many guests are welcome to attend those. I don't know what's on the next slide, and I don't have control of it. Yeah, so Renuka kind of hinted to the 15th anniversary. So in honor of our 15th anniversary, and this is our 15th anniversary, so much more to come on that, but we are going to be announcing a mini grant initiative. And so this is partially our 15th anniversary, but also just the past year. And so many nonprofits are doing so much work in our community to support women and children, and we want to help them out. There's just a huge need. And so we are going to be giving 3 $1,500 grants for organizations that our members nominate. So if you are a member and you have an organization that you think really deserves a little boost, you're going to want to watch out in your emails for a nomination form that's going to be coming very soon. So that's super exciting. It's a great way for our members to engage and maybe get some of the issues that aren't kind of getting the bigger grants to get some love too. So more to come on that. Thanks, Renuka. I think that's all I got. Oh, no, yes, member survey. How could I forget? So we launched our member survey. We got about 36 members to complete their survey, but our goal is to get 70% of our members, which really we need about 50 of our members to complete. And we have already found out so much great stuff. This right here is just an example of the type of work that our community, our members, do. And we just have incredible members. I mean, we have members in the medical industry, in the finance industry. We have members who work in nonprofit and sustainability and real estate and health and so many things. So we found out a lot about what our members are inspired by, what made them join, what they hope to get out of it, the impact they hope to make. So if you haven't completed your survey, this is a plug to complete it as soon as you can. And then, of course, stay connected with us through our social media channels. We're really active on Facebook and LinkedIn. I promise one day we will get on Instagram. We're getting there. And then, of course, our website was just revamped. And if you didn't make it to our summit, you can get all of the videos for our summit on our website. So that's it. Thank you, Renuka.
Thank you, Lauren. Sorry, I had to throw a couple more slides in there for you to cover. So I'd like to hand off to Leslie Hartog, who is one of the 2 chairs of our grants committee, to talk about the impact update for today. So with that, Leslie.
Thank you, Renuka. And I'm not going to talk for very long, but I am so excited to introduce the Early Learning Coalition to talk about grants, to give us a grants update and talk about the impact. And the reason I'm so excited is when we introduced and when first grew this and developed this great partnership and collaboration that we have with the Early Learning Coalition was while I was co-chair of 100 Women Strong. So, and as Karen puts it, I caught the bug for early childhood at that time. And as we were creating that partnership, just because it's such an important time when most of the brain of a child is being developed, and we've just got to get it right. And it has so much impact, long range impact on so many issues that we work on in this community. But what we're here to talk about today is really where are we with the grant that we did, but also I think it's a great example to share with all of our members, because the Early Learning Coalition, with the partners that they worked at in UCF, we had Dr. Kim Rank with UCF was a part of it, and other partnerships that they've developed over the years have really grown what we did and with the grant that we created. And so I think this is a great example of the ripple effect of the grants that we do here with 100 Women Strong through the collaborations that we're building. But I have to give a lot of the kudos to Karen Willis, who is the CEO.
That happens a lot when people mention my name.
Of the Early Learning
Everything
Coalition of
goes
Orange.
silent.
It happened on our community conversation call last week too with Mark. So
You froze there for a second, Leslie, but
Yeah, you mentioned my name, Leslie, and everything went silent.
Oh, everyone was just in awe. They just didn't know what to think. I'm sure that's what it is. So I apologize. I turned my video off because sometimes that helps with my connection. We've got multiple people here on my bandwidth, and so on Wi-Fi, so it happens sometimes. But what I was about to say is I give a lot of kudos to the Early Learning Coalition and what they've done with the seed of the grant that we gave, as far as how they have expanded it and grown it and scaled it and just made it their own through the partnership with the UCF and other collaborators. And Karen, I'll turn it over to you to kind of introduce your team that you have with us here today, and then tell us more about the Circle of Security, but also one of the mini grants that we introduced here during the pandemic. So.
Well, thank you, Leslie, and thank you, 100 Women Strong, for all the support that you've given us over the years, and the opportunity to speak with you today to share with you what we've done with the generosity of your group. Let me start with Mask and Smile, since it's the one that's the mini grant that is today. None of us ever would have imagined a pandemic and the impact that would have on the lives of children and families in our community. And one of the first things that happened with the pandemic was adults in childcare centers found themselves needing to cover their faces. And that is a significant hindrance to the learning opportunity of children, because they need to be able to see facial expressions for emotion regulation, and be able to see lips move in order to pick up language. So it was a very, very difficult circumstance. We began with Leslie's support to look at, was there some kind of a mask that was possible that would allow teachers to be safe around children and children to be safe around teachers, but not to negatively or to reduce the negative impact that facial coverings might have for young children. And we were able to find a clear mask. The coalition purchased them. Purchased a first group of masks, distributed them to providers, and immediately had an outpouring of requests for additional masks. It was at that point in time that the 100 Women Strong offered a mini grant to us, and with the hope that we would be able to generate additional interest from other members of our community to support this important issue with young children. So as you can see with the gentleman here in the slide, this is what these masks look like, and you definitely can see his smile. So I wanted to, at this point, turn it over to Tamara Boone, who is our Development and Donor Relations Coordinator. And with her today is Jose Diaz, who is our Community Engagement Manager. And I'm going to let Tam talk a little bit about this and the response that we got, and then we will come to the Circle of Security project. Tam?
Thank you, Karen. And thank you, 100 Women Strong. Just so you guys know, we're super excited and appreciative for all of your support. It's always a pleasure seeing your smiling faces and getting together with you. Thank you again. Your sponsorship for the Mask and Smile campaign helped to generate an additional $3,075 to purchase and distribute clear masks to childcare providers in Orange County. Your support allowed providers to show their smiles and safely create bonds with children in their care. So on behalf of course, our CEO, Karen Willis, our board of directors, and all of our staff here, we greatly appreciate you. Thank you. So a grand total of $8,075 came in towards this campaign. As you saw on the slide before, we sent out a flyer to our providers that we delivered the mask to, giving them instructions on how to send in photos of them masked and smiling. So the slide that you saw previously had that from the funding provided by 100 Women Strong. What you see in this slide is because of your $5,000 commitment, over 1,220 clear masks were distributed specifically in the Pine Hills area. The zip codes that were affected were 32808, 32811, and 32818. We targeted 61 providers, centers in this area. And you can see a few photos of these centers that are in Pine Hills. Kids Can Be Kids Childcare. I love it because he had it on his t-shirt. My Stars Learning Academy, Maranatha Early Learning Academy, and Admired Angels Childcare Center. Some of the quotes from this, the Orlando Children's Academy, as we were not able to get PPE from anywhere, and I appreciate the Mask and Smile campaign for stepping up and getting these clear masks for us. This helped us keep the reputation of having no COVID cases in any of our locations. Kids Can Be Kids said, clear masks were very beneficial and made a significant difference. We had enough to give to the students and all of our staff. It kept everyone having a great time. We truly appreciate it. We also wanted to thank Commissioner Bakari Burns and our Orange Blossom Family Health for committing $3,000 towards the Mask and Smile campaign, targeting the Paramore and Holden Heights area. With that donation, we've distributed over 600 clear masks. As you can see here, the zip codes that that benefited were 32801, 32805. The number of centers in the Paramore area were 23, and as you can see on the chart, 460 clear masks were provided in that Paramore, those two zip codes. And we also distributed masks in the Paramore Holden area with the zip code of 32806. With 7 centers benefiting and over 140 clear masks distributed. The photos you see: Learning Ladders Preschool, My Destiny Academy, Play, Laugh, and Grow Learning Center, and Raising Angels Child Development Center. It was so fun getting all these pictures back from the providers. They had a great time when they received it and putting on their masks and smiling. This is a photo of Orlando Children's Academy. They're masked and smiling. You can see some of the instructors at the tables with the children, you know, during the height of the pandemic, providing safe instruction to the children and families that come to their centers. Some of the other quotes or comments that we received from some of the providers from Little Wonders. The clear masks were beneficial to our center and our parents. It worked great for the children because they can still see their teachers' mouths and expressions during school. These masks also helped our parents. We were able to provide our parents with clear masks, and which was amazing. Admired Angels, the clear mask really helped us out during the middle of the pandemic. We use them for parents as well as teachers. We love the clear mask because the children could still see our smiles. They were kid friendly. My Stars Learning Academy, we appreciate the clear mask. It came at a great time and very handy. The clear mask donation helped us to be able to stay open and continue to function safely during these hard times. We also advertised in the Orlando Sentinel. We sent out an e-blast for over 30,000 people. As you can see, over nearly 5,000 views. People viewed this ad that was placed. Over 800 clicked on the ad. So we were really happy about this outcome. We also posted on social media, which this engagement has gone up. As you can see, over 295 impressions were made. We had a 7.5 engagement rate, and we reached nearly 300 people with this particular post. And thank you again, for 100 Women Strong for bringing the Mask and Smile to the Mask and Smile campaign to Orange County providers. I also see a comment in the chat from Leslie. She was asking, are they still wearing these masks or do they keep them on hand for future needs? Yes and yes. We still had a few in the office that were actually distributed last week. So providers are still reaching out asking for the masks.
Awesome. Thank you, Tamara.
And
Karen?
I have to say that, masks in childcare centers were very, very controversial, both for providers feeling that this was not in the best interest of children, and then parents who were insistent and wanted children masks. It became a very, very controversial issue, and I think this was a really good compromise. So I am so grateful for Leslie's leadership in looking at were there alternatives to being able to bridge that gap between what teachers need to be able to do and helping families feel comfortable. So we're very, very appreciative of this. Questions that anybody might have at this point before we move on to the Circle of Security? Okay, if there are any questions, we'd be happy to respond. Circle of Security, wow. Wow. The initial grant went to the University of Central Florida, Dr. Kim Rink, and Kim just ran with this. We just kind of tried to keep up with her. So Cindy Jury has been involved in this initiative since day one, and Cindy's going to chat a little bit about what's happened since that first grant. Cindy?
Okay, as typical, I am on mute before I realize it. Good morning, everyone, and I'm really just absolutely delighted to be here to be able to share what is going on with the Circle of Security and the ripple effects that continue from the pilot that 100 Women Strong sponsored back, it feels like years ago now, but we're really starting to see some wonderful things happening with this. So we want to give you kind of the update. Now, who's got control of the slides? If I could have the next slide, please. Thank you. As you know, can you click that again, please? No, there was more on the bottom there. Okay, No, it's not showing. Okay. I can roll with it. As you know, I was about 4 years ago, I believe, that 100 Women Strong, began talks about, what could be done in early childhood. I remember sitting around the table with Dr. Kim Rank and Dr. Neil Porras, discussing with a group of providers in Pine Hills, where the needs were, what was going on. And from that came the Circle of Security project that 100 Women Strong sponsored. And Dr. Kim Rank has really just, as Karen said, taken this and run with it. And we're now really starting to see some things going on. Advent Health, as of December of 2020, has awarded us a $50,000 a year, 3-year grant to expand the Circle of Security. And so we are just now getting this rolling, and I can tell you a little bit more about it with the next slide. Can I have the next slide, please? Thank you. Our 3-year goals with this grant are to increase, first off, the number of Circle of Security facilitators by bringing on 2 additional facilitators a year. We've actually, and this is like the really exciting part when the stars just start to align, we've actually been able to bring on several facilitators before the Advent Health money kicked in with the Florida Association of Healthy Start Coalitions. They gave us some funding to sponsor facilitators. So we're already starting out a little bit ahead of where we thought we might. The new facilitators will allow us to be able to offer this training in Spanish, which is certainly a need within our increasingly diverse community. So we're very excited about that. Our goal will also be to increase the number of early childhood teachers and staff who have completed this training. And we're looking to have 50 early childhood teachers and staff each year, over 150 altogether over the 3-year period. And then to also increase the number of early childhood programs that are participating. Each year we have a goal of 5 programs, so it'll be 15 programs over the course of 3 years. So this will really expand the initial, small pilot numbers we had with 100 Women Strong to a greater number of programs using this model in the community. Next slide, please. Our outcomes as far as the early childhood teachers, the impact we're looking to see, we want to increase teacher knowledge of responsive behaviors because we know there's some really powerful research that is coming out that shows the importance of the teacher's ability to respond in a supportive manner with young children and how that has profound long-term consequences. We're also looking to assist teachers with positive relations with children. And we know that as children come out of the pandemic, it's not going to be easy. And so teachers' ability to frame children's behavior in a more understanding and supportive and sympathetic light will be important. And then we also are looking to impact teacher job satisfaction and reduce stress, which I can't stress enough how important this is as we are experiencing a very profoundly significant workforce crisis really right now with our early childhood teaching workforce. So the more we can stabilize that workforce, the better it is for children and families in our community. Next slide, please. Our long-term goal, we want to build a cadre of experienced Circle of Security facilitators who will be able to go out throughout our community and provide this training to our early childhood teachers to help them better understand what's going on in there with our little ones and how they can support them to and respond to them in a way that helps to build young children's social emotional development and long-term success. And we also are looking, and we've received a small grant. We're looking at also expanding the Circle of Security to parents. What we'd love to be able to see is long-term being able to have the teachers are trained first in the Circle of Security so they get it and they understand it, and then be able to offer it to parents. Because we know that when parents and teachers are working together in a unified and consistent manner, that the children are really going to be the beneficiaries. So we're really, we're quite excited about the potential of that. I was out last night at Orlando Day, which is the first childcare program under the Advent Health grant that is completing Circle of Security. And the things that the teachers were saying, again, as a result of the training so far, just the connections they were making and the behaviors that they were seeing and now seeing with completely new eyes, it was just stunning. We're also able with that to have our new facilitators sit in and watch Kim Rank do her magic with this program. And that's, I think, really enormously an asset to building and expanding this program. Next slide, please.
Cindy, before we go there, Leslie asked if you could do a quick, for the new members, what is Circle of Security?
Okay,
I started with assuming everybody knew because it's such a great program.
Okay. Okay. Backtracking very quickly. Circle of Security is an attachment-based program that was developed a number of years ago to help support parents in their understanding of young children's behaviors in an attachment theory context. It really helps parents to understand the power and the strength they have in their manner of responding to children and helping children to feel more secure. When parents can reframe sometimes the behaviors that make them sometimes absolutely crazy into understanding it's a child's need for attachment and how they respond really can either strengthen or do damage to the relationship. It's really helps them to see those behaviors in a new light. The Circle of Security has also, though, been used with early childhood programs. Very early on, it was used with a Head Start program out in Spokane, Washington. We have been, I've heard of other programs in Florida that are starting to use it now. But we've just been very, very impressed with what we've seen of the programs that have gone through it, how it has helped teachers to really do a 180 in terms of their perceptions of children's behavior. Sometimes the crying or the whining, or why do they do that? They hit every nerve, or why certain behaviors may trigger teachers to respond in a way. And once they think that through, they're like, oh, okay, it's not what the child is doing. It may be calling back something from their own experience of being parented. And that's what's really profound. When you see teachers being able to evaluate what they do with children in context of the way they were raised, that you're talking some really profound long-term change. So it's been just an enormously impactful program for the centers that have been able to go through this.
I guess the best way that I explain this is behavior is the language of children, and this program helps adults to translate what that behavior is trying to tell them.
Karen, you're going to have to do it from now on, because that's like you said in 2 sentences what I blathered on for like 5 minutes about. There we go.
Anybody who has had a young child that they've had to take care of understands completely what this program is intended to do. Is to really help us relate better to children so that they are able to control their emotions better. So it's a fantastic program. So within that, this great program, there's a lot of other work that the coalition is doing. And Cindy, you want to kind of give a context of where this fits?
This is something that Circle of Security is not, an isolated project that we are doing. We see this as part of the Early Learning Coalition's vision for early childhood mental health, because we know that positive mental health and social emotional development is really critical for young children. So we are starting to build a really kind of comprehensive care model for our young children and their families, looking at what are we doing to support families, what are we doing to support children, and what are we doing to support teachers. For families, we have our Baby Institute, the Circle of Security. We have one of our childcare programs that has done Lena Grow for a number of years, is now offering the Lena Start program to parents. And our Project Hope Paramore, which really engages parents in them taking leadership for their community and their young children. For children, we have a very active inclusion support services. We are just terrifically excited this year. We received through the preschool development grant money to do early childhood mental health consultation, and I am getting rave reviews from our teachers in the programs that are piloting this. We are looking long-term at our community having a handle with care response system, whereby when children are experiencing some kind of trauma or violence has happened, that the adults around them in childcare or school are notified so that they can just be, extra TLC for the child. And we're also looking at building an early childhood crisis response team, because those of you who were in this community 6 or 7 years ago when the car went through the into the kinder care over in Winter Park know, honestly, there isn't if bad things happen in schools, there's an army of social workers and mental health professionals that descend. In childcare, that isn't the case. With the money from Florida Blue that is helping us to set this up, we've already been able to respond to a situation where a childcare center lost 2 children in an auto crash that happened in the family home, but it was one of those where the children went to the center and the teachers were profoundly impacted by that death, by those deaths. And then last but not least, because we know our teachers are, critically important to young children's mental health, we have, again, through Florida Blue, an employee assistance program that we're piloting, as well as some trauma training. The Circle of Security obviously is a key part of this for our early childhood teachers. The mental health consultation and our Lena Grow program, which we started to see some really exciting results in terms of the impact on how teachers respond to young children with language and those serve and return conversations, which are critical. So, we are just delighted that we're able to take what 100 Women Strong piloted with us, a number of years ago with Circle of Security, and build this out so that we may be better and more responsive to our young children and help them to build a better tomorrow with their social emotional development.
May I ask a question?
Yes.
Sure. So when you talked with Advent Health about the scaling this program, what were a couple of the compelling things that caught their eye to initiate the funding that they provided?
I think the thing, because Advent Health I love the process they do for funding. It's long-term. They do a lot of thinking through and talking with you about, not to the extent that 100 Women Strong does, because I think you all are still the model for funding. But what they did that was what I think really captured them with this grant was that mental health was one of their focus areas, and they really got that it's important to start early, and that the first years of life are really, critical when we're looking at, mental health and social emotional development. They were very enthusiastic about this project from our first meeting.
And I think some of, you guys really gave the community a start in mental health, social emotional development for very young children. As Cindy was saying, when the car went through the child care center, there was no response. In fact, if you read the newspaper at the time, there were a lot of people who just basically said, they're little, they'll get over it. There was not a recognition of the impact of trauma on very young children. Some of the work through this, has led to the ACEs work that's being done in our community. Kim and Cindy were part of a panel presentation on the Circle of Security initiative. And basically what we were saying is any organization in our community who feels that this is a good model, we would be happy to train appropriate facilitators and have you be part of the overall research that's being done in our community to advance this work. We really see this as fundamental to where we are going as an organization to support the social emotional health of young children, and could not be more grateful for connecting us with Dr. Rink, who really, is using this to, I believe, advance very appropriately the needs for these kinds of services for very young children. So it's not just here that you guys have had an impact. You really, really launched something that I think will have significant expansion opportunities in many, many places. So again, we're very appreciative. As are our providers, trust me. We could have given you lots and lots of stuff that they've said on this too.
Yes.
So thank you. Don't know what else we might be able to offer in terms of an update. You can tell we were very enthusiastic about both initiatives and very timely. And we hope that you guys will think of the little guys again. And if the Early Learning Coalition can be supportive in helping you with your dreams, we would love to be part of that.
That's wonderful. Thank you. I know we do have a few members on. Does anybody have any questions for Karen and the team?
I think there were a couple that I saw pop up. Cindy, can you talk about how we're doing training for the facilitators at this time?
Yes. The facilitators have to go through the standard Circle of Security facilitator training. We're identifying individuals in the community who we know through our network who have, are able to, work with our diverse childcare community and really get this information. And we also have one of our childcare providers. We're excited about her because we think she'll be able to take it within our Hispanic Latino community very well. We're training them. Then they're sitting through Dr. Rink's Circle of Security, which they're just, the feedback I'm getting there is just, just amazing. And then we're looking at getting them, set up with trainings in our community. So that will be happening through late summer and into the fall.
And I also know a plug for K-Ready under Leslie and Lauren's leadership is looking at circles as a significant piece of the work that they would like to see expanded. So, whatever supports we can provide around that, we are more than happy to do, because it's another great opportunity for our community to benefit.
Thank you for the plug, Karen. And my question was going to be related because there's so much attention and talk about trauma, and not just from the trauma from the pandemic, but in general with ACEs, which is adverse childhood experiences, for those of you who aren't familiar with that term. And what we do about it is the big question. So there's a lot of work through the Peace and Justice Institute on resiliency training and ACEs, and then there's a lot of work in the school system on to address mental health issues. To me, and through K-Ready, in recognizing how big of an issue that is, we felt that, and the experts that we've been working with really felt like Circle of Security is kind of the answer for what you do about it in early childhood. So is that how you're thinking of it as well?
Well, this Circle of Security is a great tool for any child and any adult interaction. It's particularly helpful for times where folks are on their last nerve with kids, which is oftentimes a lot, particularly during the pandemic, when we've had a lot of families that have been, together more so than, sometimes it's good to get a break from your children. I think that the way that I'm looking at this is we want to infuse Circle into every child care center that is willing to look at this as a productive way of interacting with children. But we also know that there are children who have issues that require further intervention, and families that have issues that require further intervention. Hence why we have looked at the what Cindy referred to as our early childhood mental health consultation. Actually having trained mental health professionals, behavioral specialists, going into child care centers, observing and supporting the teachers for those children that need additional support. So I think that this is a great beginning and a great service that should be offered in every early childhood program. But I also think some of these other things, the employee assistance program, if your teacher is stressed, she just really needs somebody, an adult to talk to, this employee assistance program allows her to do those kinds of things. So it's really, that's why Cindy wanted to show you the full package of what we're looking at here. Because as much as we count on this industry to take care of our most vulnerable and in the most robust period of human development, we do so little to support the women who do this work. And that's really what this is. And then the activities that we're hoping to expand beyond our Baby Institute to support families. Because kids, once they leave a child care center, they go home. They go home. And what can we do to help those families? And Cindy can tell you, families who come into child care centers and said, I don't know what you've done with my child. They're behaving differently.
I can actually just on Monday was talking with a provider who is part of our initial pilot with the mental health consultation project. And she said, I had a child that I was ready to show them the door. This child was just like, I couldn't do anything. And just, she was ready. We know that preschool expulsion is an issue, especially, with our young boys of color. She began the mental health program, was working with her consultant, and she said, I can't believe what a difference it has made. It has helped me so much. He's doing so much better. And then she said to me, and his mom says he's doing better at home too.
And the thing is everybody goes, the child has changed. No, the adults around the child have changed to allow the child to express what he's feeling, what's going on with him. And that's really, behavior is the language of children.
And this is why we see it's this quilt of care that we can offer to our children, to our families, to our teachers, to, everything is not one size fits all, but what is the need and how can we best address that need through a more comprehensive system of early childhood mental health services.
Wow.
I love the term that you use, Cindy, the quilt of care, because these issues are complex, right? I use the term with my engineering brain, the system, because there's so many pieces to this. And with 100 Women Strong, I know we're striving to not just look at one program as the fix for everything, because as we decide how to spend our money, we really need to look at it, look at the whole child and all of the pieces of the quilt or the system. So I love the way that you're approaching mental health.
And I think, Leslie, you'd also mentioned to me the Calming Circle, the program that you guys funded that uses the animals. We never outgrow the need for understanding. And, so we appreciate the fact that you guys are looking at this across the life of children and how we really support kids to be successful adults. Calm classrooms, thank you. Those are like what we call our, oh my gosh, it just went totally out of my head. It'll come to me. Yes.
Yeah, that's the program we have in flight with the Orange County Innovation District, and again, University of Central Florida as our research partner to introduce furniture, activities, the Calm app, and whatever the teacher decides is appropriate in the classroom for, it could be an animal, it could be plants. There, some of the classrooms are doing little farms to create, you know, basically a calmer classroom environment for both the teachers and the students. So that's in flight now. It was impacted because of the pandemic, but it started off earlier this year. And our previous update in March was from the Innovation District about how that's doing. And we hope to get an update from UCF once the measurement component of that kicks off. But you're right, it's a continuum of early childhood care and then what happens in elementary schools. And some of the areas we've explored move into higher education, but we keep coming back to that early learning, second grade, third grade as the pivotal years for what happens with women and children at the output side if that level of support is not provided.
Well, and I think the initiatives that you guys have been funding are going to be all that much more important as children return to bricks and mortar, regardless of their age. You know, we already know that we have 4,000 fewer children that went through the VPK program this past year that will be entering kindergarten this year. That's going to add stressors that we haven't seen in a while. You know, this is, all of these things are going to be really very, very important as we bring children back. So again, thank you all very much for your time. I think we're well past the amount of time that you gave us, but again, we're so appreciative of the support. And our last pitch is we have an event coming up. Tam, you want to tell us about it?
Yes. Next week, we wanted just to invite you all to attend our first 5 years virtual celebration. This is our second virtual event. So for some of you, you may not know, we formerly had our first 5 years gala, and that was an in-person event. But due to the pandemic, we had to pivot and have a virtual event. So this is the second year. Hope next year it will be in person. It is on Thursday, June 24th, starting at 11:30 a.m. So from 11:30 a.m. to 12, it will be pre-show, networking, perusing our virtual silent auction, and the event will be from 12 to 1. We would like to invite you to have lunch with us and stream the event. This is the first time we're doing it at lunch. I'm super excited, and I hope you all can join us. You can register at the bit.ly link that you see on there. And yes, I can send you the graphic, Lauren, for this event.
Thank you so much. And just to hand off to closing, looks like we don't have any more questions. We covered that part pretty well, I think. So just another reminder, you can connect with 100 Women Strong on social media, and we have a monthly newsletter as well for members that goes out for updates and information like that. Thank you so much, Karen, Tamara, Cindy, Jose. I don't know about you, but there were moments when I was tearing up. So thank you so much. It's really nice to hear that the work that we do is scalable, that it's continuing on, and it really gives us a lot of encouragement as we continue to look for new ways to approach old problems.
Thank
you
all.
very much, ladies. We truly appreciate your support. Thank you.
Thank you.